Good afternoon. It's my pleasure meeting you. My name is Keliki from South Sudan, cohort 2024, WomenLift Health, working for us as a technical officer. I am an experienced humanitarian and developmental worker with over 15 years of experience, focusing on reproductive health and leading team in the development of innovation tools and focusing on the access of quality voluntary family planning and the reproductive health for marginalized group of people and underserved. I'm addressing a male resistance and lack of support to family planning and contraceptive use for women and girls in the country. There are some driving factors that had led me to choose that project in the country of South Sudan. The providers are threatened with physical violence, health workers sought death. That is the report we have got last year and even as well as in the beginning of the year, without the consent of their parents and girls. Yet South Sudan has the poorest health indicator in the world. The contraceptive prevalence rate is only 5%. And out of this, only 1.7% of women reporting using modern contraceptive. Imagine this fertility rate is estimated at 7.1 children per woman. That is the report normally we get from CIP 2021. The maternal mortality ratio is up to 1,229 per 100,000 live birth, among the highest worldwide. The report we will get from World Health Organization 2023. Less than 44% of the population has access form of the healthcare service, while 80% of the births happen at home without the skilled birth attendants. That has led not yet, family planning is not yet widely recognized and practiced in the country. The percentage of married women and unmet need of modern contraceptive prevalence is 31%. Ministry of Health 2018 report says. My project has got intervention to include male into the family planning project. One is we conducted a survey. The survey we conducted, we developed a questionnaire that is aligned to the project. We have got data collectors and we training them to interview. After the interview, we analyze the data and we disseminate the findings among the project team. And that has led us to design the program to approach male engagement. There was also a focus group discussion we conducted with the influencer, the traditional leaders, religious leader, not forgetting even the youth leader, plus the intelligent women leaders. In the meeting, we have been initiated to ensure community embrace family planning benefit. There was a serious dialogues we conducted in various regions, of which we are able also to include the religious leaders, traditional leaders. We found they are the influencer in the country to foster an inclusive understanding of the family planning benefit. We have encountered challenges during implementation. One of it is the cultural resistance, actual leading percentage of the resistance of male involvement into family planning that has run deeply in the country to move men out of the family planning. Conversation challenges to accept the project arise from the resistance of the community leaders and next stakeholder. However, during the dialogues, we have got a role model that has contributed deeply on how he lost two wives while he was resistant to access family planning. And that has given a lesson as he became a role model after getting his last wife. He took the wife for the access of family planning, of which he was given a 5 years family planning contraceptives. After the 5 years, the woman was able to get her last baby. As per now, she's breastfeeding, and he became a role model, and he was the one giving an example during the dialogues. There was also political instability I have ever experienced during the accessibility and consistency of the project activity and the conflict and the political unrest. Resource constraints was there, such as scaling community engagement effort has been shown that limited funding and logistical process to the project. And also some of the areas are so much affected by the flooding, and it made forceful displacement of other community, limiting the geographical areas of the project. Leadership journey aligned. The project engaged diverse stakeholders, strategical leaders through meticulous planning, impact through continuous evaluation and adaptive strategy. The project personally has served as a learning curve for my professional growth managing stakeholder, making data-driven decisions and being sensitive to cultural nuances. In conclusion, WomenLift Health Support has brought a lot, so the project will greatly increase the ability to overcome male resistance of family planning and bring about lasting change in the country. The project will reach its vision of improving gender and health outcome by using WomenLift Health leadership training through with the support of coaching, mentoring program, advocacy experts, and resource network, including the allies. Thank you.